Depression's a common condition in women. Probably up to 1 in 3 women may have a depressive episode in their lifetime. Menopause is not a risk per se of depression, but hormonal fluctuations that can occur after childbirth, with menstrual cycles, and certainly with the cessation of periods can predispose someone who's already vulnerable to depression. So estrogen is not a treatment for depression, but estrogen is a mild mood elevator. It helps support serotonin. So it's not surprising to me that this study would show that women who have longer exposures to estrogen by virtue of having a later menopause are less likely to have neuropsychiatric problems like depression. Women that have early surgical menopause are at much higher rates for neuropsychiatric problems, including depression, Parkinson's disease, and even memory loss. The sex hormones affect the neurotransmitters in the brain: acetylcholine, dopamine, norepinephrine, and when there's an imbalance in some of the neurotransmitters, there can be mood symptoms. In menopause, women's estrogen levels drop. And since estrogen acts like an MAO inhibitor and helps boost some of the serotonin levels in the brain, people who already have low levels are going to potentially have lower levels. So that's why there's some women who, when they lose their hormones, get mood symptoms. Anytime someone loses their hormones before age 40, that's definitely premature. And that happens to about 1% of women. And that does definitely need to be treated with replacement hormone. That being said, the average age of menopause is around 51 and a half. Anywhere from 45 to 55 is typical. But there are some women who can menstruate into their late 50s and not be hormonally deficient. And we know that women who have later menopauses have longer lifespans. And we also know that women who undergo menopause who take hormones, particularly within 10 years of menopause, for at least 5 to 10 years, have lower death rates. So estrogen has lots of benefits throughout the body: the brain, the skin, the bones, the genitals. And when you lose estrogen, for whatever reason, it accelerates the aging process. And it can make other conditions potentially worse or harder to deal with. And psychiatrists have known for a long time that when women have adequate estrogen levels, they seem to respond to the typical antidepressants like the SSRIs usually better. For any woman who is stopping her periods or not having any periods or having hot flashes, or even if she has no hot flashes, she's having any trouble with concentration, mood, memory, sleep, just doesn't feel right, it could be due to not enough estrogen. And so certainly a woman should see her women's health care physician and get this checked out. And women who are hormonally deficient should not be afraid of taking hormone therapy. Unfortunately, in 2002, when the Women's Health Initiative results hit the headlines, there was a precipitous drop in the use of hormone therapy, which is very unfortunate. This happened worldwide. And actually in America, we have seen higher death rates in women since that time. And there's still this persistent thought that people should not be on hormones or should take them for the shortest period of time for the lowest dose. And that's simply not true. Just like with any condition with lack of hormones, whether it's insulin or thyroid or sex hormones, you want to have an adequate level for your age and stage in life. And so there is no time limit, and people have to be assessed. And those that are low in estrogen can have a lot of consequences. I think that it's good for those women who have a late menopause or good for those women who continue to have hormone exposure past menopause, because those folks are going to do better in general from a mental health perspective, from a bone perspective, and potentially also from a cardiovascular perspective. There's this critical window of benefit, it seems like, on the brain and on the arteries of when a woman goes into menopause and loses her hormones, as opposed to waiting 10 or 15 or 20 years and already having existing disease. Then using hormones, it's not going to help. It's going to be too late at that point for the most part, except for bone. So there is this critical opportunity for women to realize. Now, just because you're in menopause does not mean you're hormonally deficient. It is a natural life event, and there are women who make enough hormones in their ovaries and adrenal glands, and they feel great, okay? But for those people who have mood symptoms, can't sleep, hot flashes, dry vagina, bone loss, aches and pains, slower metabolism, just don't feel the same, then they need to be evaluated and treated. And women need to be reassured. And women need to seek out a physician that understands this data, because there's a lot of people out there that are going on incomplete information or are not the most up to date on the research. And I think this adds further to the bulk of the data, particularly with respect to mental health. The diagnosis of menopause is made by the history and physical exam, and you can do some selected blood work in terms of an FSH and estrogen level. However, what's in the blood or spit is not as important as what's inside the tissues. And so that's why a good physical exam and a good history is very helpful in helping to determine that, as well as the woman's response to what therapy that you put her on. So people who feel much better, sleep better, mood is better, memory is better, then clearly you know replacing those hormones was a good thing to do. And so a woman kind of serves as her own bioassay. But it is more challenging and not as straightforward as, say, replacing thyroid in someone who gets low in thyroid, which 1 in 8 women do. Or even replacing insulin in someone who's a diabetic. But even when you're done with reproduction, those sex hormones have effects throughout the whole body, and you do need at least a certain amount in many cases so that you don't have symptoms or acceleration of disease related to not enough estrogen. When I see someone who's 58 and they're having hot flashes or can't sleep or their mood isn't the same, and you give them treatment and they feel better, that's great. But the fact is, if you're 58 and you don't have hormones, you're not going to magically start making them when you're 59. Right. And so that concept of people think they go through menopause, it's not like you go through a town and then come back home, okay? You're entering into it. Metabolism changes, there's genetic effects, diet, other medical conditions. So it's very complicated, but you're not going to start making estrogen again. And we do know from lots of observational data, randomized controlled trials, this study here, that the longer someone gets exposed to estrogen, generally the better they do. So thank goodness, we're now in 2016 and we have lots of different options for hormones.